So today we'll talk about or discuss lactate dehydrogenase, the clinical significance of lactate dehydrogenase, the sources, the methods used in the determination of lactate dehydrogenase. Okay, and what are the disease correlation of lactate dehydrogenase? Okay, so for lactate dehydrogenase, it catalyzes the interconversion of lactic and pyruvic acid. Okay, so that's the function of lactate dehydrogenase. So it's a hydrogen transfer enzyme, so meaning it transfers hydrogen. Okay, lactate dehydrogenase. Okay, so tissue sources, it's widely distributed in the body. High activities or the major sources, you have heart, liver, skeletal muscle, kidney, and erythrocytes. Lesser amount present in lungs, smooth muscle, and brain. Okay, so these are the sources, the minor and major sources of lactate dehydrogenase. Okay, so next is regarding the diagnostic significance of lactate dehydrogenase or diagnostic uh, or the disease correlation of lactate dehydrogenase. Now, regarding LD or lactate dehydrogenase, it is elevated in a variety of disorders. So it's not specific. An increase in total LD is not specific. Okay? It's better to measure the different isoenzymes of LD compared to using the total LD concentration. Okay? So an increase in total lactate dehydrogenase level is not specific. Okay? Now, what are the diseases that are associated with increased lactate dehydrogenase? So first, if there is cardiac disease, or for example, if there is myocardial infarction, okay, there is increase in total lactate dehydrogenase. Another is hepatic disease, renal disease, and hematologic and neoplastic disease or disorders. So, for example, if there is hemolytic anemia, it is expected that the lactate dehydrogenase level is increased. Okay? So that's for lactate dehydrogenase. Now, highest levels are seen in pernicious anemia and hemolytic disorders. So for pernicious anemia is an example of megaloblastic anemia, meaning there is large presence of large red blood cells. Okay? Now, these large red blood cells, the reason why your body is producing large red blood cells is because of the deficiency in vitamin B12. Okay, that's for pernicious anemia. Now, since the RBC is big, it has a tendency nga ma-hemolyze siya or there will be hemolysis. It's because since big man siya, it's easy for your spleen to sequester that big RBC. Okay, diba? The function of your spleen is to sequester or to remove, okay, abnormal RBCs or abnormal RBC. So, meaning if big siya nga RBC, i-sequester din siya. So, na destruction of red blood cells. That's why there is increase in lactate dehydrogenase in pernicious anemia. Next, liver disorders, AMI, and pulmonary infarct. There is 2 to 3 times increase, okay? 2 to 3 times upper limit of normal in your total LD. But increase in total LD value or concentration is not specific, okay? Non-specific finding. So, to increase the clinical significance, okay, of lactate dehydrogenase, we need to separate the total LD into different isoenzyme fractions. Okay? So LD assays assume more clinical significance when separated into isoenzyme fractions. Okay? So meaning Ato siyang i-separate into 5 fractions because there are 5 normal isoenzymes of lactate dehydrogenase. Okay? Now, regarding the peptide chain, okay, of lactate dehydrogenase, there are two polypeptide chains, the H and M. H is H meaning heart, M is muscle. Okay? So for the isoenzymes of lactate dehydrogenase, we have 5 major isoenzymes of lactate dehydrogenase. So LD1, 2, 3, 4, and 5. So regarding the polypeptide chain, for LD1, you have 4 H. H, 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 H. For LD2, you have 3 H, 1 M. H, 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 M. For LD3, 2 H and 2 M's. Then LD4, 1 H, 3 M's. Then LD5, all M na siya. Okay? So, for LD1, the major source, you have heart, red blood cells, and kidney. Same with LD2, heart, red blood cells, and kidney. For LD3, you have lungs, lymphocytes, spleen, and pancreas. For LD5, you have liver, and LD4, liver, LD5, skeletal muscle. So what are the disease correlation? So LD1, for heart, you have myocardial infarction. Okay? Red blood cells, you have hemolytic anemia. So if there is hemolysis, intravascular hemolysis, or meaning in vivo hemolysis, the concentration of LD is elevated. If there is renal infarct for kidneys, it's also elevated. Megaloblastic anemia, okay? Example, you have pernicious anemia. So it's easy for your body to sequester those big red blood cells, okay? Hemolyzed specimen, okay? So you're not allowed to use a hemolyzed specimen for lactate dehydrogenase determination. Why? Because RBCs or red blood cell is one of the major sources of lactate dehydrogenase. Okay? So once there is hemolysis or you're using a hemolyzed specimen, the LDH concentration will shoot up. Okay? For LD2, same with LD1 regarding disorders. And LD3, lungs. So, for example, if there's pulmonary embolism, then next is extensive pulmonary pneumonia, then lymphocytosis, acute pancreatitis, and carcinoma. So, among the 5 isoenzymes of lactate dehydrogenase, LD3 is classified as a tumor marker, meaning LD3 is elevated when there is carcinoma. But it's not specific nga for a certain type of cancer. Okay? So, dahang cancer nga associated with increase in LD3. Next, LD4, hepatic injury because ang major source is liver. Then, for LD5, skeletal muscle injury. Okay? So, these are the enzymes, isoenzymes of lactate dehydrogenase, the tissue sources, and disease correlation. Next, regarding the migration rate, this one is LD1. Okay, LD1 is the fastest to migrate in your electrophoresis, followed by LD2, 3, 4, and 5. So the slowest is LD5. Then, among the 5 isoenzymes, the major or the predominant isoenzyme in a healthy individual is LD2. So LD2 is 29 to 39, while LD1 is 14 to 26. Okay? So, ang pasunod ana, parang, sani, in terms of concentration, the predominant one is LD2, followed by LD1, 3, 4, and 5. In a healthy individual, ha? Okay? So, next, cardiac tissue and red blood cells contain higher concentration of lactate dehydrogenase 1. Now, if there is a flip pattern, so this one is the flip pattern, LD1 is greater than LD2. Okay, diba, in a healthy individual, LD2 is greater than LD1. Okay, in a healthy individual. If there is myocardial infarction, okay, cardiac tissue involvement and red blood cell involvement, meaning if there is hemolysis, if there is pernicious anemia or megaloblastic anemia, those uh, conditions are associated with flip pattern, meaning LD1 is greater than LD2 instead of LD2 greater than LD1. Okay? So for flip pattern, it's associated with cardiac tissue involvement and red blood cell involvement. So flip pattern is of greatest clinical significance when used with CK isoenzyme analysis in the diagnosis of AMI. So for diagnosis of AMI, you need to have CK MB of greater than 6%. Okay? Greater than 6%. And the presence of flip pattern. That's for the diagnosis of AMI. Next, conditions with increased LD3. Okay? Carcinomas because LD3 is a tumor marker and if there is pulmonary involvement. So if there's a problem with your lungs, LD3 is increased. Next, LD4 and LD5 found primarily in liver and skeletal muscle tissue. LD5 levels have greatest clinical significance in the detection of hepatic disorders, particularly intrahepatic disorders. So regarding LD5, it's abundant in skeletal muscle, but you can use LD5 to check for damage in your hepatocytes. So LD5 is increased and also LD4 if there is liver involvement. Now, there's also another isoenzyme of lactate dehydrogenase, the LD6. So it's not LD6 is not normal isoenzyme of lactate dehydrogenase. It is present in patients with atherosclerotic cardiovascular failure. And it will appear, okay, in your plasma or in your blood, and the appearance of LD6 signifies a grave prognosis and impending death of the patient. Okay, so this is not a normal isoenzyme of lactate dehydrogenase. Okay, now regarding the increase in LD5 and LD6, it represents hepatic congestion due to cardiovascular disease. Okay, so meaning if there is cardiovascular failure, automatic your liver is affected. Why? Because the heart provides uh, blood supply, or it's the source of blood paingon sa imong liver. Okay? So your liver is dependent to your heart in terms of perfusion or oxygen delivery. So if there's a problem with the cardiovascular health, your liver is also affected. That's why there's increase in LD5 and LD6. So it may reflect liver injury secondary to severe circulatory insufficiency. So meaning there is insufficient blood supply. Now, next is regarding the analysis of isoenzyme. There are two ways. First is to perform electrophoresis. Okay, so you can separate the different isoenzymes using electrophoresis, and it's the most widely used method. Another is to perform immunoinhibition. So this one, it is used to measure LD1. Now, for this method, you're going to use antibodies that will react with M subunit. Okay, diba? There are two subunits or polypeptide chain in your lactate dehydrogenase. It's either H or M. Okay? Now, LD1 does not contain any M polypeptide chain or subunit. It only contains H. Okay? So for immunoinhibition, you're going to add antibodies that will react with M subunit. Meaning this antibody will react with LD2, 3, 4, and 5. Okay? LD2, 3, 4, and 5. So after that reaction, you're going to eliminate 2, 3, 4, and 5 lactate dehydrogenase. So the isoenzyme that will remain in your sample, it's your LD1 na lang. Okay? So for immunoinhibition, this is used to measure LD1. And LD1 is very significant if we talk about cardiovascular involvement, red blood cell involvement. Okay? So that is for immunoinhibition. Okay, so next is the assay or the methods used in the determination of lactate dehydrogenase. So lactate dehydrogenase catalyzes the interconversion of lactic and pyruvic acid using the coenzyme NAD+. So the reaction can proceed either the forward or reverse direction. So for the forward, you have the conversion of lactate to pyruvate. That's the forward reaction. Okay? For the reverse, you have the conversion of pyruvate to lactate. Okay? So the name of the method, okay, in the conversion of lactate to pyruvate or the forward method, it is called as Walker method. And for the reverse, that is your Robrusky-Ladu method. Okay? Now, the rate of the reverse reaction is approximately three times faster, allowing smaller sample volumes and shorter reaction time. So these are the advantages of the reverse direction. Three times faster, smaller sample volume. Okay, and shorter reaction time. The optimal pH for the forward reaction is 8.3 to 8.9, whereas that for reverse, it's 7.1 to 7.4. Okay? So, regarding the forward method, which converts lactate to pyruvate, lactate is a more specific substrate compared to pyruvate. That's why the forward method is the most commonly used method because lactate is a more specific substrate, okay, for lactate dehydrogenase. LD1 prefers the forward reaction while LD5 prefers the reverse reaction. LD is stable at room temperature for 48 hours. So for the method, you have the Walker method or the forward reaction. So it's the most commonly used method. Why? It's because lactate is a more specific substrate for lactate dehydrogenase. Okay. For Roblewski-Ladu, it's 2 times faster, but it's also the preferred method for dry slide technology, and it requires smaller specimen volume requirement. The downside lang of Roblewski-Ladu method in terms of specificity, for Roblewski-Ladu, you're using pyruvate as substrate. So in terms of or regarding specificity, lactate is more specific substrate to your lactate dehydrogenase. Okay? Next, sources of error. Erythrocytes contain an LD concentration approximately 100 to 150 times than found in serum. That's why you need to avoid hemolyzed specimen, okay? Or you need to avoid hemolysis because hemolysis greatly affects your lactate dehydrogenase concentration, okay? Stored at 25 degrees Celsius or room temp and analyzed within 48 hours. LD5 is the most labile isoenzyme or cold labile, meaning you should not store an LD5 specimen in cold temperature because that cold temperature will inhibit LD5. Serum samples for LD isoenzyme analysis should be stored at 25 degrees Celsius and analyzed within 24 hours of collection. So, why man dili siya gina-store sa refrigerator? It's because we don't want to inhibit the activity of LD5 because LD5 is uh, the most labile isoenzyme. So, once you expose that one to cold temperature, automatic there's inhibition or inactivation of LD5 activity. Okay? So, I think that's all for lactate dehydrogenase. So, remember, flip pattern. You have acute myocardial infarction. renal infarction, and megaloblastic anemia, okay, or hemolytic anemia. And another is hemolyzed specimen. LD3 is a tumor marker, okay. LD3 is a tumor marker. So if there is increase in LD3, meaning there's a possibility nga na carcinoma or cancer. Okay? So I think that's all. Remember pa day, regarding the subunits of lactate dehydrogenase, for LD1, it's H lang. For LD2, we have 3H and 1M. LD3, you have 2H and 2M. LD4, 1H, 3M. LD5, all M. Okay? So thank you and God bless.